Today's federal budget does keep the pharmacare debate alive as long as the government hasn't settled on what a pharmacare plan will look like and when Canadians will see it and who will get coverage. CPAC's Martin Stringer has more on that with three members of Parliament. Martin.
I'm joined now by three MPs who are going to talk healthcare and what was in the budget. I'm joined by the Parliamentary Secretary to the Minister of Health, Pam Damoff, who's an Ontario MP. I'm also joined by the Conservative health critic, Marilyn Gladu from Sarnia, Ontario. And I'm joined by Davies, who's the NDP health critic from BC. I want to start, first of all, with the Parliamentary Secretary. A lot of us were waiting for something more concrete in terms of what the actual pharmacare program is going to be. Why is it taking so long to tell Canadians what you're going to offer them or what you're going to do in terms of pharmacare?
Well, we want to get it right, and we've got Dr. Hoskin and the Advisory Council right now are looking at it. We've implemented the three recommendations that they had in the preliminary report, and so it's a good first step. It's not the end, as the Finance Minister said in his budget speech. This is the first step on the way to a national pharmacare program, but there are three really important parts of pharmacare that were in the budget.
Right, the National Drug Agency, for example. But here's a question, though, politically. There's a reference in the budget to you're awaiting the final report of Dr. Hoskin's advisory committee. One would think that that is going to be ready just in time for election time.
Well, you'd have to ask Dr. Hoskin that. I don't know when it's going to be done. You know, it's going to be the spring. I honestly don't know when it's going to be presented.
Marilyn Gladu, what do your reaction on behalf of your party to the health measures in this budget?
Well, for sure, a big build-up on the pharmacare and big letdown, because there's $5 million this year in the pharmacare bill and nothing till 2022. So that's not anything about a pharmacare plan. So certainly we will have to wait for Eric Hoskin's report and some other action, because this is a nothing burger. But I would say that with respect to the other parts of the health, there was a lot of things mentioned, but not very much money. So if we think about the opioid crisis, $6 million a year more to help, and there's 4,000 people a year dying in Canada. So very inadequate on that. $10 million for dementia, a huge escalation in dementia with an aging population. So those are just some of the things that I saw that, although they touched the right topic, it was with an inadequate response.
Okay, Don Davies, your reaction, what you saw in the budget?
Well, it's deeply disappointing. There's absolutely no commitment to pharmacare, and we're the New Democrats. We're the only party now that's on record as committing to a universal, comprehensive, and single-payer or public pharmacare system. And you know what we saw in here was really nothing. I mean, they're proposing to create a Canadian Drug Agency which simply merges two existing bodies right now, the Pan-Canadian Pharmaceutical Alliance and CADTH, to put them into one. And then even that, it says that they will roll that out over the next 4 years and work with the provinces to declare or to determine a vision or mandate. They don't even have a vision or mandate for the Canadian Drug Agency that they identify as a precursor to pharmacare. So the Liberals are just kicking this can down the road. They refuse to commit to universal public pharmacare, and that's because I think they have no intention of actually delivering on it.
One question that did come up to us, those of us who were studying the budget in the budget lockup, is that there is this, and Marilyn Gladu refers to it, there's a commitment to rare diseases, medications for rare diseases, and the federal government says that you're going to take it over and show a leadership role. But it's only for 22-23. Why so far in the future? I mean, we're talking about 5 years in the future. Why does it going to take so long to take at least that part of the pharmacare puzzle?
Well, I mean, there's a number of pieces to the pharmacare, and there's a plan there, which we didn't have before. The federal government wasn't showing leadership before. They were leaving it to the provinces and territories to try and figure this all out. And I'd like to comment, too, we've got a suicide line that's been put in place that's going to save lives. We're not going to be having people dying by suicide. And $150 million for the Terry Fox Research Institute to create the Marathon of Hope Cancer Centers across the country. That's a significant investment in something that is going to, just like Terry brought together Canada, it's going to bring these research institutes together that will give us a cure for cancer. So, I mean, there's significant investments that are going to make a difference for Canadians, a difference for their health.
Okay, last question to the Conservative on the panel, Marilyn Gladu. Obviously, this is a pre-election budget, and we've just talked about the politics of maybe having a full pharmacare promise. The Conservative Party, where do you stand? Because Don Davies has referred to the NDP being in favor of a single, universal, single-payer pharmacare program. What are the Conservatives? What's your official position on pharmacare?
Well, the Conservatives believe that Canadians should have access to their medications regardless of their ability to pay. So we'll be looking for a solution that will address that. About 98% of Canadians actually already have some kind of pharmacare plan. So we would be looking for a solution then that would fill the rest of them and make sure that people do have access to the medications.
Any place so for a government-run pharmacare program?
We certainly don't support the single-payer universal system that the Health Committee brought forward at $35 billion cost per year. We think that's really unaffordable for the taxpayer.
Well, on that, we're out of time, but I know we will be bringing this issue up again. It's a big one, and I want to thank you for taking the time. Pam Damoff, thank you very much. Marilyn Gladu, thank you. And Davies, thanks for taking the time.
Excellent. Have a good night.